Hello fellow DNP students, this is Erin McGuire, and today I'm going to be covering Chapter 6 of the Terry textbook, and my topic today is going to be on designing a clinically based quantitative capstone research project, and what some of the advantages and disadvantages are of each one. During this presentation, a few of the objectives that I'm going to cover, we're going to describe the advantages and the limitations of quantitative research designs. I'm going to discuss the differences in experimental versus non-experimental and then quasi-experimental research. We're going to discuss the possible threats to internal and external validity, and I'm going to describe some ways to minimize threats to internal validity and increase external validity when developing your research design. So some of the basics of quantitative research, most of the time when we're talking about quantitative research, they're going to break it down into experimental studies, which can be your randomized controlled trials, your pre-test, post-test designs, or clinical trials. And then you've got the non-experimental or your observational studies, and those can be your cross-sectional surveys, your longitudinal studies using cohorts, and case control studies. And then the book is going to further break it down also into quasi-experimental, and I'll talk about those at the end of this lecture. So when I got into this chapter, I really wanted to look at the advantages and the limitations of quantitative research. And some of the strengths that you're going to find in quantitative research is, at its best, the quantitative approach is going to be rigorous, it's focused, it's tightly controlled. The procedures are going to involve precise measurement data. It's going to produce reliable and replicable data that is going to be generalizable to other contexts. It's going to be relatively quick and provide good value for your money. And quantitative findings tend to enjoy a universally high reputation with almost any audience or stakeholder. Your weaknesses or your limitations, though, there's a lack of subjective data on human interactions when determining social, internal, or holistic phenomena. It's not sensitive to uncovering the reasons for particular observations or the dynamics underlying the examined situation or the phenomenon. And a lot of times participants may have a negative impression of the intent of the study due to that detached and clinical nature of the design. So these are some of the things that you maybe want to take into consideration when you're looking at doing a quantitative research project. So the first type of research designs I'm going to talk about are going to be the experimental ones, and these are going to be focusing on the randomized controlled trials, the pre-test, post-test designs, and then the subgroups of the clinical trials. And there are various types of experimental designs. They each have their strengths, they each have their weaknesses. The experimental design is it has that potential to produce high quality data and resemble the controlled experiments performed by basic science researchers. The experimental study, it's going to be most useful for supporting that cause-effect relationship, and it evaluates the efficacy of prevention and therapeutic interventions. So researchers are going to make an effort to control for all variables except the one that's being manipulated or that independent variable. And the effects of the independent variable on the dependent variable are going to be collected and analyzed for that relationship. And so that's what that experimental research design is going to try to accomplish. So the first type of study I'm going to talk about is that randomized controlled trial. So this is going to be the best type of study design, or the gold standard for evaluating the effects of a treatment or intervention, because it has the strongest design for testing cause and effect relationships. So randomized controlled trials have three distinct characteristics. One, the experimental group there's going to be an experimental group that receives the treatment or intervention, a control or comparison group that receives standard care or a comparison intervention that is different from the experimental intervention, and three, it's going to have randomization or random assignment, which is the use of a strategy to randomly assign subjects to the experimental or the control groups. So random assignment is the strongest method to help ensure that the study groups are similar on demographic or clinical variables at the baseline or before the treatment is delivered. Similarity between groups at the beginning of an experiment is very important in that if findings reveal a positive effect on the dependent variable, it can be concluded that the treatment, not the extraneous variables, is what affected the outcome. So for example, results from a random control trial might reveal that a cognitive behavioral intervention reduced depressive symptoms in adults. However, if the adults in that experimental and control groups were not similar on certain characteristics prior to the intervention, such as level of social support, number of current stressful life events, it could be that differences between the groups on these variables accounted for the change in the depressive symptoms at the end of the study instead of the change being due to the positive impact of the cognitive behavioral intervention itself. So that's why, this is the gold standard, because there is that random assignment, there's that treatment group, there's that control group, and then at the very end they're going to compare the results between the two. So I've included a diagram just to kind of give you a visual of what the random control trial is going to look like. So the randomized controlled trial is a true experiment, or it's one that's going to deliver an intervention or treatment in which subjects are randomly assigned to a control in an experimental group, as we already said. This is the strongest design to support cause and effect relationships. And research subjects, as we said, are randomly selected to be in the experimental group and receive a new intervention, or to be in the control group and receive a standard intervention or no intervention at all. So randomization and control are going to be essential features of this design. Biases can occur without randomization, and it allows both known and unknown factors to be distributed in a uniform way. Selection bias can be a threat to internal validity, and internal validity I'm going to explain later, but this is that ability to infer that the independent variable in a research project is truly related to the dependent variable. So when a threat is present, there is a competing explanation for the results obtained in the project. Another method of reducing bias is the utilization of blinding, and blinding is a situation that occurs when neither the research subject nor the person assessing the outcome of the treatment is aware of the group to which the subject belongs. So with randomized control trials, there is a lot of time and money commitment when you're using this type of design, and it's most likely more commitment than a D&P student can afford. The next type of experimental design is going to be the pre-test, post-test design. So in this design, or a classic experiment, subjects are randomly assigned to either a control or experimental group. Both groups are pre-tested. So as you can see from the design here, that's what I've got here with the R's and the O's and the X's. So both groups are pre-tested, as I said. The experimental group is exposed to treatment or different treatments, and then both groups are going to be post-tested. So this is a representative diagram of what a two-group random control test with a pre-test, post-test design is going to look like. So R is going to stand for the random assignment, X is going to be your intervention or treatment, where X1 is the experimental intervention and X2 being the comparison or control intervention. And O is your observation or measurement. O1 is being the first time the variable is measured at baseline, and O2 being the second time that it is measured, such as after the intervention. So this is a pretty common way that statisticians will actually express experimental designs to people. A lot of times they're going to use the R's, the O's, the X's to help differentiate between the random assignment, the intervention, and the observation. The fundamental weakness of this design is that it's difficult to attribute causation to the intervention where there is neither randomization nor a control group. So this could mean that some other factor has affected the outcome of the research study. This might be the only practical method of assessing the impact of an intervention, though. The pre-test, post-test design can be strengthened by using a control group who also have a pre-test and a post-test, using more than one pre-test in both groups, and using multiple time points for assessing the outcomes in both groups. The next design that we're going to talk about is the Solomon four-group design, and this is a variation of the pre-test, post-test design that I just talked about. So in the Solomon four-group design, subjects are randomly assigned to one of four different groups. Two of the groups are pre-tested and two are not. So only one pre-tested and not pre-tested group are then going to be exposed to a treatment, and all of the groups are then post-tested. So a pair of experimental and control groups receive pre-testing. Those are going to be depicted by O1, and a pair who do not receive pre-testing. R, again, is random assignment. X is going to be your interventions or treatment. X1 is the experimental intervention, X2 being the comparison or control intervention. O will represent observation and measurement, where O1 is the pre-test, or it was measured at baseline, and O2 being the post-test, which means it was measured after the intervention's delivered. So the advantages to the Solomon 4-group design is that it has the ability to assess the presence of pretest sensitization. Disadvantages, though, it's going to require a large number of research participants for this design. It can sometimes be difficult for the researcher to introduce treatment or intervention at exactly the same time for the groups, and it may be difficult to randomize subjects to only one of the 4 groups in question. The next one we're going to talk about are clinical trials. And a clinical trial is used to evaluate the efficacy and safety of a new drug or a new medical procedure. And this type of research design is utilized when randomization is not feasible or ethical, or when evidence is insufficient to justify the difficulty and expense of a randomized control trial. This can sometimes be called quasi-experimental or a non-equivalent control group due to research participants in groups who were not randomized that will not be equivalent. So with the randomized or non-randomized control trials, these are more practical and more feasible, but they are weaker than that true experimental design. And one of the primary weaknesses of this is that you have a failure to ensure randomization in these these design types. Alright, so now that we've talked about the experimental research designs, I'm now going to move into the non-experimental research designs. So we're going to look at the cross-sectional surveys, longitudinal studies using cohorts, and case control studies. So typically your non-experimental designs are going to be used to describe, explain, or predict a phenomenon. And these types of designs are also undertaken when it's undesirable or even unethical to manipulate the independent variable, or in other words, to impose a treatment. So an example of this would be, that it would be unethical to assign teenagers randomly to receive an illegal drug like ecstasy in order to study its effects on sexual risk-taking behaviors. So therefore, an alternative design would be a prospective descriptive study in which sexual risk-taking behaviors are measured over time in a group of adolescents who use ecstasy compared with a group who has never used any drugs. A research design is considered non-experimental if there is systematic collection of data but no use of control groups or randomization of subjects and no use of statistical control. So the cross-sectional survey. A survey is going to be a type of descriptive study where self-report data is typically collected to assess a certain condition or a status. And most survey research is cross-sectional, which just means that all the measurements are collected at the same point in time. So survey data can be collected by multiple strategies. It can be personal or telephone interviews, they can be mailed or even in-person questionnaires. So an example of this would be healthcare providers might be surveyed with a questionnaire to measure their knowledge and attitudes about evidence-based practice, for example. So data gained from this survey might then be used to design in-service education workshops to enhance their knowledge and skills in this area. So a cross-sectional survey would be a great design study for that type of research. So the major advantages of survey research is that you get rapid collection of data and there's a lot of flexibility. But the disadvantages of survey can include low response rates, especially if the surveys are mailed, and then gathering information that is fairly superficial. So while it is, very, very quick to do, if you don't have good response rates, you may not get the data that you're wanting. A longitudinal study is going to follow a group of people over time. So if the researcher chooses, the cohort can be sampled over multiple points in time. And this method is useful to address a question regarding potential harm to a patient in a clinical situation when it would be unethical to perform a randomized controlled trial. So a cohort study generally involves the study of people who have been exposed and are followed over time with selected health outcomes compared with another group who have not been exposed. So this type of research would be appropriate if the researcher was interested in whether daughters of mothers who had breast cancer had a higher incidence of the disease versus those whose mothers did not have breast cancer. So the two groups of daughters, those with and without a mother with breast cancer, would then be studied over time to determine the incidence of breast cancer in each group. The major drawbacks of the cohort study is that they are expensive and they're very time consuming. These studies also suffer from attrition, where there's a loss of research subjects that occurs during the course of the study, which is what makes follow-up difficult or sometimes even impossible. It is practical, though, that it is able to determine the incidence of a problem and its potential causes. So they do use this a lot, especially with cancer when they're trying to find links between causes of cancer. And this is great when it's unethical to perform that randomized controlled trial, as we already said. Case control studies are those in which one group of individuals, your cases, with a certain condition such as migraine headaches, is going to be studied at the same time as another group of individuals who do not have the condition to determine an association between one or more predictor variabilities. So those predictor variabilities could be family history of migraine headaches, consumption of red wine, and then the condition itself. Case control studies are usually going to be retrospective, which means that they look back in time to reveal predictor variables that might explain why the cases contracted the disease or problem and the controls did not. Advantages of this type of research design include an ability to determine associations with a small number of subjects, which is especially useful in the study of rare types of disease, and an ability to generate hypotheses for future studies. One of the major limitations of this study design is going to be bias, or that inability to control confounding variables that may influence the outcome. So an example here would be two groups of individuals discussed, those with migraines and those without, may be different on certain variables like amount of sleep and stress levels, and that also may influence the development of migraine headaches. Another limitation is that because case control studies are usually retrospective, one is limited to data available at a prior time. So often data on interesting variables were not thought to be important and not collected a lot of times. Okay, so we've now talked about the experimental designs and the non-experimental designs, and so now we're going to the next category, what we call quasi-experimental research designs. And the quasi-experimental studies, these are going to be designs in which the independent variable is manipulated or introduced, but there is a lack of random assignment or a control group. And although quasi-experiments may be more practical and feasible, they are weaker than experimental designs in the ability to establish that cause and effect inferences, or to say that the independent variable or treatment was responsible for a change in the dependent variable, and that the change was not due to any other extraneous factors. So there are times when quasi-experiments are going to be needed to conduct because random assignment is not always possible. So an example would be individuals cannot be assigned to smoking and non-smoking conditions. Even when it is ethically feasible to use random assignment, the study setting may preclude it. So, another example I use, school principals are going to resist assigning children to programs based on random assignment. So in addition, random assignment can be distributive in schools, like taking children out of their regular classrooms for special programs. Quasi-experiments, these are designs that compare groups created by some method other than random assignment, and it provides an alternative to that true experiment. So despite their limitations, some of these designs can be quite powerful in their ability to eliminate alternative explanations for the relationship between an intervention and the outcomes in the study. And so what we're going to talk about with the quasi-experimental is going to be the one-group post-test only design, the non-equivalent control group design, and a time series. Alright, the one-group post-test only design. This is the primary quasi-experimental research design. A post-test design is simple and straightforward. This type of design is done with one group, no comparison group, or between two groups with a comparison group of participants. And the participants are going to receive an intervention and then they're going to be tested afterwards. So this type of design might be utilized if a company wanted to know whether employees benefited from a recent employee training conference. So following the implementation of the training conference, employees would be given a short survey or your post-test to assess their satisfaction with the conference. These surveys are used to provide feedback and make changes to next year's conference, and this is similar to what educators utilize at the end of the semester with their course evaluations. So this is not recommended for a researcher who wants to draw conclusions about the outcome resulting from an application of a specific intervention. The next type of quasi-experiment is going to be the non-equivalent control group design, and this is used for research in field settings. It looks very similar to the true experiment with the exception of random assignment into groups. The key problem with this design is the difficulty determining whether the experimental and comparison groups were similar when the study began, and this method also has multiple threats to internal validity. So since we mentioned internal validity, I'm going to go ahead and discuss the threats to internal validity. And internal validity, it's the extent to which it can be said that the independent variable or the intervention causes a change in the dependent variable or the outcome, and the results are not due to other factors or any alternative explanations. And there's a number of major threats to internal validity of a study that should be addressed in the planning process. So these are things as you're going through your capstone project, you want to try to minimize the amount of internal validity threats. So one of them, I'm going to start at the top of the circle there, is going to be selection or confounding. The best strategy to control for or minimize the influence of confounding variables is to randomly assign subjects to study groups. Another strategy is going to be to establish thoughtful inclusion and exclusion criteria. Also, maintaining consistency among the study conditions for all participants will reduce this chance. One way to ensure consistency is to establish clearly written study protocols so that every individual on the team understands the intricacies of when and how the interventions will be delivered, as well as the steps of data collection. History is the next threat. This happens when external events take place concurrently with the treatment that may influence the outcome variables. So an example is if a study is conducted to determine the effects of a violence prevention intervention on anxiety in school-aged children, and a school shooting occurs with extensive media coverage during the course of the trial, children's anxiety levels at the end of the study could be high despite any positive effects of the intervention. So to reduce this threat of history is random assignment, because then both groups would be equally affected by the external event. Maturation. This is the passage of time that can impact the outcomes of a study. So for example, when you're studying infants who are growing rapidly, an acceleration in cognitive development may occur regardless of the effects of an intervention that is aimed at enhancing cognition. So to deal with this threat, you want to use random assignment to allocate subjects to experimental and control groups, as well as to recognize it as a potential alternative explanation for the study's findings. For testing, completing measures repeatedly could influence an individual's responses the next time a measure is completed. So an example, answering of the same depression scale 3 or 4 times could program someone to respond in the same way on subsequent administrations of the scale. So you want to take that into consideration with your research design. Instrumentation. This threat occurs when there are changes in the way variables are measured or techniques used for observation that will cause changes in the measurements obtained. So you want to keep an eye out for multiple observation test points in the study. So to reduce this threat, it's important to maintain consistency at each observation step, and this includes the instrument, the administrators, and the method of administration utilized. The last one we're going to talk about is mortality, and this is the loss of study participants from the time of administration of the pretest to the time of administration of the post-test. If the subjects who remain in the study are remarkably different from those who do not complete the study, the results will probably be influenced. Prevention strategies are going to include not to overly persuade individuals from participating, and keep in mind that increased hesitation to participate could lead to dropping out from the study, so you don't want to overly persuade research subjects. Offer research subject a small honorarium for participating. You can offer at different completion points. Maintain periodic communication throughout the study. Maintain consistency with who follows up with the participants, and also reduce subject burden. Subjects may feel overwhelmed if at each check-in there is a lot of questions and it's time-consuming. So as a general rule, the easier and less time-consuming, the greater the probability for completion. In a time series design, there is no random assignment or comparison group. This design is going to incorporate a long series of pre-test observations, an intervention, and a long series of post-test observations. The time series design is used most frequently in communities or agencies that maintain careful archived records. It also can be used with community survey data if the survey questions and sample remain constant over time. An intervention effect is evidenced if a stable pattern of observations over a long period of time is found, followed by a marked change at the post of intervention, and then a stable pattern again over a long time after the intervention. So this could be useful in tracking truancy rates of an adolescent and then track it over several years. It would be followed by an intervention with continued tracking of truancy rates for several additional years. If there's a marked drop in truancy rates at the point of the intervention, then there's reasonable evidence of the program's effect. So we've already talked about internal validity, and now we're going to talk about what external validity is. So the experimenter has to take into consideration the threats to external validity, and this means that the results can be generalized to other populations. So the burden becomes to minimize specific threats to the greatest extent possible. Threats to external validity are going to compromise confidence in stating that the study results are applicable to other situations, and there are going to be explanations of how you might be wrong in making these generalizations. So pre-test sensitization. So post-test scores of pre-tested subjects may not be representative of the unpretested population of subjects if the subjects are pre-test sensitized to the effects of the intervention or treatment. Interaction of selection and experimental treatment. So in the case of bias in the selection process, a test group may be produced who respond to the independent variable in ways not typical of the larger subject population. There's also reactive effects of experimental arrangements, and this occurs when conditions of the experiment are not representative of real-world situations. Multiple treatment inference. If multiple treatments were applied simultaneously, changes can be seen that are different from what would occur if one treatment alone were used. Irrelevant responsiveness to measures. The measure used may include irrelevant components that indicate change has occurred when in fact it actually has not. And then irrelevant replicability of the treatment. Researchers fail to include the part of the intervention or treatment actually responsible for creating change each time the research subjects are exposed to it. So some specific examples of threats to external validity. So is your sample selected randomly? If not, it may be open to selection bias. Have you included a pretest? In some experiments, pretests may influence the outcome. A pretest might clue the subjects in about the ways they are expected to answer or behave. Are your participants taking multiple versions of the same test? If so, the practice effect might influence your results. Is your sample composed of a homogeneous population, like all low achievers or all high achievers? If so, your results probably won't be generalizable to the average person. And are your results of your study tainted by the Hawthorne effect? Your study participants may be behaving differently because they know they're in an experimental study. So these are things to kind of consider when you're creating your design and then also when you're looking at the results that you're getting. So in overview, when you're developing a capstone project for a DNP program, the focus is most likely going to be on an individual patient or a group of patients. And quantitative research is going to be concerned with patterns that are unique to a population of patients and can be particularly useful for investigating the effectiveness of an intervention. So when you're deciding on which type of study is most appropriate for your project, take some time to review the different types and determine what's going to be most effective for your capstone project. So I know there was a lot of information in here. I hope that you found this presentation useful on your journey towards developing your projects. If you have any questions, please let me know. Thanks.